move down into the forearm. So now we're going to cross the elbow joint, move down into the forearm, and talk about some of the muscles that move across the elbow, move across the wrist, that is, and help with action to cross the wrist joint. So either flexion of the wrist, which is bringing the palms closer to the forearm, or extension of the wrist, which is bringing them further away. Now, there are two bones that make up the forearm, which we discussed last week, the ulna and the radius. These are connected internally by an interosseous membrane that is going to span across these two bones and act as an attachment for some of the muscles that we'll discuss, but also help to separate the compartments anterior and posterior of the forearm. Okay, so this membrane is what helps to create these two compartments. The anterior compartment, all of these muscles that we're seeing here are all flexors. These are going to help with flexion across the wrist. Notice how the tendons actually cross to act at the hand. So the tendons here will insert onto the bones of the hand. So when these tendons shorten, they're going to bring the bones towards the forearm, which is flexion happening at the wrist. This includes eight different muscles that we'll speak about. And then the extensor compartment, has 11 muscles that we'll talk about. Okay, let's talk about the superficial layer of the flexor compartment. So because we have quite a few muscles here, some are more superficial, some are intermediate, some are deep. We want to divide those layers so it's a little bit easier to understand and help you to memorize these muscles as well. So in the superficial layer, we have four muscles, the pronator teres, and pronator teres is one of the shortest muscles here. It's also going to be one of the only ones that runs across in more of a horizontal fashion, which helps us understand its action. It is a pronator. And if we think about supination and pronation, the muscles that help to bring about pronation are going to help to move the forearm bones more horizontally as opposed to more vertical flexion extension. So these muscles are going to be more horizontal in their location as well. Okay. Then we have flexor carpi radialis, again, in that sort of orderly fashion, the next muscle in line, flexor carpi radialis. And the name here, flexor, because it flexes. Carpi, where does it flex? It flexes across the carpal joint. Radialis, because it's on the radial side of the forearm. So let the names help you understand the location as well as the action. Flexor carpi radialis is telling me everything I need to know about this muscle. It's a flexor, which tells me it must be on the anterior side, must be in the anterior compartment. It flexes across the carpal joint, so it must be flexing across the wrist or inserting onto the hand, and then it's on the radial side, so it must be more lateral. Palmaris longus is one of the unique muscles of the forearm. It's going right along the center. It has a longer tendon than any of the other muscles, and it's also the most superficial. Interestingly, palmaris longus is not present in everyone. It's only present in about 14% of the population, so it's very rare to find folks who have this muscle, and then we can find, folks who don't have it as well, so, or cadavers that don't have it. Now, one of the interesting ways to tell if you have it is to kind of clench your own fingers, right? To clench your own wrist, and you'll see the very prominent tendon if you do have it. And if you don't have it, you may not see that tendon as prominent. So definitely check it out on yourself. Try to claw your fingers together and flex at the same time, and you'll be able to see if you have that palmaris longus. Next, we have flexor carpi ulnaris. So again, flexor carpi, this one is on the ulnar side of the forearm. So flexor carpi ulnaris is going to be the most medial of the four that we're describing. So pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. If we take those muscles off, we're going to encounter some of the intermediate muscles, and this is one large muscle that has many tendons and many different bodies. This is the flexor digitorum superficialis. And this is in between the superficial layer and the deep layer. And as the name would imply, it's going to flex the digits, but it's going to be the superficial version of that muscle because we do have a deep version of that muscle that we'll talk about. So it's going to have 4 different heads going to each of the 4 digits, hence the term digitorum. And the main action of this muscle is flexion of the digits, right? Bringing the digits to help us move the fingers together. If we take that muscle away, we're going to encounter the deep layer. This is including 3 muscles. Flexor digitorum profundus. We just talked about superficialis. Here's profundus, which is the deeper layer. It's also a muscle attached to 4 different tendons that will insert on the 4 digits respectively. But this is just the deeper layer going all the way out to the very distal digits. If we look at the insertion for superficialis, superficialis only goes to the proximal phalange, right? It doesn't go to the very distal. Whereas, this is superficialis, excuse me. Superficialis going to the proximal phalange. Profundus goes all the way to the very distal phalange. So profundus helps us to flex the very distal edge of our digits, whereas superficialis helps to flex at the proximal phalanx. All right. Next, we have flexor pollicis longus. The word pollicis implies the thumb or the first digit, and flexor pollicis longus because we also have a flexor pollicis brevis, which is a muscle found in the hand itself. So the name again here will help you understand the longer version of this muscle is actually in the forearm. And then the deeper muscle here, pronator quadratus, again, another pronator muscle, so it must be running horizontally. It's going to help us pronate, but more of the distal forearm bones, very similar to pronator teres, is up here. But this one is going to be a part of the deep layer as opposed to the superficial layer. So the 3 deep muscles here, flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. Okay. Let's look at the posterior forearm. So we're going to flip the arm over to look at the posterior muscles. These are going to be extensors. So most of the terms here, or the names here, will start with the word extensor, except the very first one, which is brachioradialis. And brachioradialis is somewhat of an anomaly. It's found or seen to be anterior. It's actually been removed here. This is more of a posterior view. Let's go back to an anterior view. So here's an anterior view, right? And here's brachioradialis. So on looking at the arm, on looking at the forearm, it appears that brachioradialis would be an anterior muscle, but it's not. It's still going to be considered a part of the posterior compartment because of the way it acts, okay? It can also be sometimes confused with brachialis, which is in an arm muscle, and biceps, because they're very close in proximity. But again, it's not going to be acting across the elbow. So it's going to be a true forearm muscle, but a part of the posterior compartment as opposed to the way that it would imply, right? Or the way that it seems. So on a posterior view, we really can't see the brachioradialis, but because of its location and its action, it is going to be considered a superficial posterior muscle. Next, we have so here's the brachioradialis, very small edge of that can be seen posteriorly. Next, we have extensor carpi radialis. There's longest and brevis to this muscle. Longest being the outermost of the muscle, brevis being the very deeper muscle underneath. So here's longest, and then the edge of brevis can be seen. And the word longest meaning long, brevis meaning short. Next, we have extensor digitorum. An extensor digitorum would have tendons that go to most of the digits. So, right, 4 digits that would be having extension of those digits coming from extensor digitorum. And then we have extensor digiti minimi, which is much smaller and right next to digitorum. This is going specifically to the fifth digit, the pinky finger, hence the term digiti minimi. And then the most lateral muscle here being extensor carpi ulnaris, okay? Now, I also want you to realize that flexor carpi ulnaris can be seen from a posterior view. So don't confuse flexor carpi ulnaris with extensor carpi ulnaris simply because we can see it on the lateral edge of the arm attaching to the ulna. So flexor carpi ulnaris is going to be more within or more medial as compared to the flexor, or extensor, sorry, more medial to the flexor. So those are our six major superficial muscles in the posterior compartment. And the best way to remember these is to think about the order in which they flow. This is why we're discussing them in this order, so that you can use that as a way to help you remember their location. So brachioradialis, extensor carpi radialis longus, and then deep to that would be the shorter brevis, then extensor digitorum, then digiti minimi, and then extensor carpi ulnaris. Let's look at the lateral anterior view, still looking at superficial muscles, but more from a lateral perspective. Here we can get a better view of the first three of those six muscles: brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis. Okay, shorter. All right. Let's look at the deeper muscles here. So these are the other three muscles that are a little bit deeper: extensor digitorum, extensor digiti minimi going just to the fifth digit, and then extensor carpi ulnaris, which is on the ulnar side. From a deeper view, we can see that it is on the ulnar side, but remember, when all the muscles are in place, it does appear more medial when we can see flexor carpi ulnaris. And then if we take all those muscles away, we have a deep layer of the posterior compartment. And let's talk about those five muscles here. First, we have the supinator. And supinator is going to help biceps brachii in bringing about supination, okay? And again, think about the appearance of this muscle. Both the pronators and the supinators have more of a horizontal appearance because of their actions, right? They help the forearm bones to circumduct over one another or rotate over one another, which is what helps to bring about supination and pronation. Next, we have some of the muscles that move the fingers, the digits themselves. So abductor pollicis longus. This muscle is going to help to abduct the thumb. And there is a short version and a long version. So this is the longest here. The abductor pollicis brevis is going to be a shorter, smaller muscle that is found closer to the thumb in the hand, okay? Next, we have extensor pollicis brevis. Extensor pollicis brevis is going to be just deep to abductor pollicis longus, all right? And then we have extensor pollicis longus. So extensor pollicis longus and extensor pollicis brevis are going to be in close proximity, with brevis being deep or underneath both extensor pollicis longus and abductor pollicis longus. And then fourth, we have extensor indicis, which is going to extend, the index finger or the second digit, hence the term extensor indicis. So really understand how the name can help you with the action, and understand what digit it's going to or where it can be found, right? The location. All right, lastly, we have the hand muscles. So the hand muscles are the thenar and hypothenar muscles. The thenar, all right, I apologize. I'm kind of getting over a cold, so I'm a little congested here. So the thenar muscles are found on the lateral side, the radial side, or the thumb side. And these are individually named. They're smaller muscles. We're not going to focus on the specific names of the thenar muscles, but we do want to understand where they are and that they act more so on the thumb and the first three digits. Whereas the hypothenar muscles are going to be on the pinky side or the fifth digit, and they're going to have less of a function, less of an active role in hand movement, but act more so on the fourth and fifth digit and on the hypothenar side of the hand, right? The ulnar side of the hand.